Tendinopathy is a common condition that affects the tendons, leading to pain and reduced function. It often results from overuse and can significantly impact daily activities and athletic performance. Tendinopathy can be divided into two main types: tendinitis, which involves inflammation, and tendinosis, which is a chronic, degenerative process without much inflammation. Symptoms can range from mild discomfort to severe disability, making effective treatment essential for many patients. In this video, we'll explore the latest advances in treating tendinopathy, focusing on percutaneous needle tenotomy and related techniques. Historically, tendinopathy has been managed with a variety of conservative treatments. These include rest, activity modification, pain medications, physical therapy, and therapeutic exercises. While many patients respond well to these methods, up to 20% do not experience sufficient relief. For these individuals, more aggressive interventions such as corticosteroid injections or even surgery have been considered. However, these options come with their own risks and limitations, including possible side effects and inconsistent long-term results. Recently, ultrasound-guided percutaneous needle tenotomy, PNT, and the TNEX procedure have emerged as promising alternatives for patients with tendinopathy. These minimally invasive techniques aim to stimulate healing in the affected tendon by creating controlled microinjuries. PNT uses a fine needle to repeatedly puncture the tendon, while TNEX employs ultrasonic energy to break down and remove diseased tissue. Both procedures are typically performed under ultrasound guidance, ensuring precision and safety. Percutaneous needle tenotomy, also known as tendon fenestration, involves using a thin needle to puncture the affected tendon multiple times. This process is guided by ultrasound imaging, allowing the physician to target areas of chronic tendon damage. The repeated needling induces a localized healing response, increasing blood flow and growth factor activity in the tendon. The goal is to revitalize tissue that has failed to heal with conservative care, promoting recovery and reducing pain. TNEX procedure is a specialized form of percutaneous tenotomy that uses ultrasonic energy to break down and remove diseased tendon tissue. A handheld device with a vibrating needle is inserted into the tendon under ultrasound guidance. The device simultaneously irrigates and suctions away the damaged tissue, leaving healthy tendon behind. This technique is designed to minimize trauma to surrounding tissues and accelerate the healing process. Evaluate the effectiveness of PNT and TNEX. Researchers conducted a systematic review of the literature. They searched multiple medical databases for studies involving ultrasound-guided percutaneous tenotomy, including both PNT and TNEX procedures. Only English-language studies with relevant outcome data were included. The review followed established guidelines to ensure a comprehensive and unbiased assessment of the available evidence. Review included 20 studies that met the criteria for analysis. These studies varied in design, including retrospective case series, prospective cohorts, and randomized controlled trials. The quality of each study was assessed using established risk of bias tools, with most studies scoring high for internal and external validity. This careful selection process ensured that the review's conclusions were based on reliable and relevant data. Patients included in the reviewed studies ranged widely in age and gender, with both men and women represented. The tendinopathy regions treated included the elbow, Achilles tendon, patella, gluteal tendons, plantar fascia, and more. Most patients had symptoms for several months or even years before undergoing PNT or TNEX, highlighting the chronic nature of their conditions. Across the studies, both PNT and TNEX were associated with significant reductions in pain. The most commonly used measure was the visual analog scale, VAS, which showed marked improvement after treatment. Many patients experienced pain relief that was sustained for months or even years, with some studies reporting benefits lasting up to 7.5 years. These results suggest that minimally invasive tenotomy can provide long-term relief for chronic tendinopathy. In addition to pain relief, patients treated with PNT or TNEX often reported improved function. Standardized outcome measures such as the disabilities of the arm, shoulder, and hand DASH, and the Low Extremity Function Scale, LEFS, showed clinically meaningful gains. These improvements translated into better quality of life and increased ability to participate in daily activities and sports. 7 studies focused on medial elbow tendinopathy treated with PNT. Most of these studies demonstrated significant improvements in pain and function, as measured by VAS and DASH scores. The benefits were consistent across different patient groups, and no significant differences were found between PNT alone and PNT combined with platelet-rich plasma, PRP. This suggests that PNT is an effective option for patients with stubborn medial elbow pain. Lateral elbow tendinopathy, often known as tennis elbow, was the most commonly studied condition. 16 studies included patients with this diagnosis, and the majority reported substantial pain reduction and functional improvement after PNT or TNEX. Some studies showed sustained benefits for up to several years, and patient satisfaction rates were high. These findings support the use of minimally invasive tenotomy for chronic lateral elbow pain. Achilles tendinopathy was addressed in 2 studies using the TNEX procedure. Patients experienced significant reductions in pain and improvements in function, as measured by VAS and the SF-12 quality of life scale. Satisfaction rates were high, with most patients reporting they were either very satisfied or somewhat satisfied with their outcomes. These results highlight the potential of TNEX for treating chronic Achilles tendon problems. 3 studies examined gluteal tendinopathy treated with PNT or TNEX. Patients showed clinically significant reductions in pain and improvements in hip function. These benefits were observed both in the short term and at longer follow-up periods. The evidence supports the use of ultrasound-guided tenotomy for patients with persistent gluteal tendon pain who have not responded to other treatments. Gluteal tendinopathy, often seen in athletes, was treated with TNEX in several studies. Patients experienced significant pain reduction and improved knee function, as measured by the Kujala scale and LEFS. These improvements were sustained at long-term follow-up, suggesting that TNEX is a valuable option for those with chronic patellar tendon pain. Patients with plantar fascia pain, commonly known as plantar fasciitis, also benefited from TNEX treatment. Studies reported significant reductions in pain and improvements in lower extremity function. These results were consistent across different patient groups and follow-up periods, supporting the use of minimally invasive tenotomy for chronic heel pain. TNEX was also used to treat less common tendinopathies, such as those affecting the triceps, hamstring, tensor fasciae lata, and iliotibial band. While the number of patients was smaller, the results were generally positive, with most reporting pain relief and improved function. These findings suggest that ultrasound-guided tenotomy may be effective for a wide range of tendon problems. One of the key advantages of PNT and TNEX is their safety profile. Across the reviewed studies, adverse events were rare and generally mild, such as temporary pain or minor skin irritation. Serious complications were not reported, and most patients tolerated the procedures well. This makes minimally invasive tenotomy an attractive option for those seeking alternatives to surgery. Some studies compared PNT or TNEX with platelet-rich plasma, PRP injections. The results showed similar improvements in pain and function between the groups, with no clear advantage for adding PRP. This suggests that PNT and TNEX alone are effective for many patients, though further research may clarify whether combining treatments offers additional benefits. While the results are promising, there are limitations to the current evidence. Many studies had small sample sizes, non-randomized designs, and relied on patient-reported outcomes. There was also variability in how outcomes were measured, making direct comparisons difficult. More high-quality randomized controlled trials are needed to fully establish the effectiveness of PNT and TNEX across different tendon regions. Not every patient with tendinopathy is an ideal candidate for PNT or TNEX. These procedures are generally reserved for those who have not responded to conservative treatments. The decision to proceed is often based on the duration and severity of symptoms, as well as patient preference. Careful assessment by a healthcare provider is essential to ensure the best outcomes. Both PNT and TNEX are performed as outpatient procedures under local anesthesia. Ultrasound guidance allows for precise targeting of the affected tendon. The procedures are relatively quick, and most patients can return home the same day. Recovery times vary, but many patients resume normal activities within a few weeks, with gradual improvement in pain and function. Success of PNT and TNEX is thought to be due to their ability to stimulate a healing response in chronically damaged tendons. By creating controlled microinjuries or removing diseased tissue, these procedures promote increased blood flow, growth factor release, and tissue remodeling. This helps to restart the healing process in tendons that have failed to recover with rest and therapy alone. Several studies reported sustained benefits from PNT and TNEX, with improvements in pain and function lasting for years in some cases. This long-term effectiveness is particularly important for patients with chronic, stubborn tendinopathy who have not found relief with other treatments. Ongoing follow-up and rehabilitation may further enhance these positive outcomes. High levels of patient satisfaction were reported in many studies, with most patients expressing that they were satisfied or very satisfied with their results. This reflects not only the effectiveness of the procedures, but also their minimally invasive nature and quick recovery times. For patients struggling with chronic tendon pain, these new options offer hope and improved quality of life. Ultrasound imaging plays a crucial role in the success of PNT and TNEX. It allows clinicians to visualize the tendon in real time, identify areas of damage, and guide the needle or device with precision. This reduces the risk of complications and ensures that the treatment is delivered exactly where it is needed. While current evidence supports the use of PNT and TNEX for several types of tendinopathy, more research is needed. Future studies should focus on larger, randomized controlled trials, direct comparisons between different techniques, and long-term follow-up. This will help to refine patient selection, optimize treatment protocols, and further improve outcomes. For clinicians, PNT and TNEX offer valuable tools for managing chronic tendinopathy that does not respond to conservative care. These procedures can bridge the gap between non-invasive treatments and surgery, providing effective relief with minimal risk. Patient education and shared decision-making are key to achieving the best results. In summary, ultrasound-guided percutaneous needle tenotomy and TNEX are safe, effective and minimally invasive options for treating chronic tendinopathy. They provide significant pain relief, improved function and high patient satisfaction with a low risk of adverse events. While more research is needed, these techniques represent a major advance in tendon care. As research continues and technology advances, the role of minimally invasive tenotomy in tendon care is likely to expand. Patients and providers can look forward to even better outcomes, more personalized treatments, and new options for managing chronic tendon pain. Staying informed about these developments will help ensure the best possible care for those affected by tendinopathy.